Usually, the piriform fossa, just this area, okay? Just one side, there is the larynx, this fold, okay, epiglottic fold, and laterally thyroid cartilage. So just you see, this is thyroid cartilage. So one area the thyroid cartilage and another this fold. Here is not clear.
Maybe here, doctor?
Yeah, just.
The big bottle? What? Open it يعني. علشان ما تقدر تشرح عليها أصلاً.
Here you see this is piriform fossa. You come here. This is piriform fossa, okay? You see this is piriform fossa.
Where is it?
Yeah. You see there is a depression here.
This is the esophagus?
No. This
Where's the piriform fossa?
Continuation. Back to the larynx. This is laryngeal inlet. So piriform fossa, you see one side, the medially, it is the epiglottic fold, and laterally the medial surface of the thyroid cartilage. So this is thyroid cartilage, you see. So it's just you see here, its lateral boundary is formed by the medial surface of the thyroid cartilage, okay, and medial boundary is formed by the epiglottic fold. This is area. So this is piriform fossa. Okay? So when the foreign body comes, usually it loses here.
Where it
Here.
closes?
Yeah, here. This is piriform fossa. Okay? So this is boundary. This is one boundary. This is the medial boundary. This is the lateral boundary, thyroid cartilage. And here, recurrent in the floor of this fossa, recurrent laryngeal nerve and internal laryngeal nerve located here. Okay, it passed through this. From here, then it's supplied to the muscles here, the sensory supply here. Because recurrent laryngeal nerve, now vocal cord.
Recurrent and internal.
Internal laryngeal nerve. Okay? Just everybody just show from here. Just want to see the vocal fold. Just whitish area. Just you see here the whitish area. Everybody try to see. That's a whitish area. That is the true vocal fold.
What is it?
Just you see here. You are see whitish area inside this this larynx. Whitish area just inside the larynx.
Okay.
You see here. That is true vocal fold.
The white one.
The white
one.
Okay.
True. And up to that true, the sensory supply is internal laryngeal nerve, and below that vocal fold, sensory supply by the recurrent laryngeal nerve.
Okay.
Recurrent laryngeal nerve. Okay. And both the nerves, just it passes through the floor of the piriform fossa. Internal laryngeal and recurrent laryngeal. Recurrent laryngeal. Internal sensory, purely sensory, okay? But recurrent, it's motor and motor, because it supply all the laryngeal muscles except cricothyroid, which is supplied by the external laryngeal nerve.
Okay. So internal sensory only, recurrent is sensory.
Recurrent sensory as well as motor.
External or the motor?
The recurrent is supplied down from the vocal cord and downward. This is sensory supplied by the recurrent, right?
Recurrent, yeah, below the vocal. Palatine tonsil, just I want to show you.
شاطرة. برافو. درءا للمفاصل. لا هي قاعدة أصور. إيه بس لا ما جيت أنتي. أنا حاطتها على المودلز لا أقول درءا للمفاسد.
Yeah, you see here this is lingual tonsil, okay? This is lingual tonsil, posterior part of the tongue. This is lingual tonsil. Okay, this is the lymphoid follicle on the posterior surface of the tongue. Okay. Lingual tonsil. Okay. This is tubal tonsil. This is tubal tonsil. This is lingual tonsil.
What is the tubal?
The palatine. This is okay. And the palatine tonsil is here from the uvula. Just can you fix it? Just please. But one thing remove. This is pharyngeal muscles, okay? Yeah, this is constrictor muscles of the pharynx. This is constrictor muscles. Just we fix it and then
Okay.
this is the constrictor muscles, okay?
Like this.
Yeah.
Okay.
أصلاً أحكي له كذا.
Over this.
This is بيدي.
اللي له قاعدة
This is the
فيها ثانية ما
constrictive
جابها.
muscles.
Yeah, this is
of pharynx.
constrictor muscles, superior, middle,
Okay.
and then inferior down.
Okay.
Yeah, just
Should I put it?
yeah, you just put it here.
Wait. Okay. I can't see so يعني.
Yeah.
هذه هنا ولا فين؟
No.
أي
Here.
حلو ليه؟
Yeah.
أي تبدأ.
Yeah. Okay, so you see here, these are the constrictor muscles of the pharynx, okay? Constrictor muscles, superior constrictor, this is middle constrictor. So you see overlapping, this is superior, then middle over this, and inferior also the down.
Okay.
So just I want to show you the uvula. So you see the uvula, just everybody show, this is uvula, this is uvula. So on each side of the uvula, there is a space. This is the exact location of the palatine tonsil, because one is the palato glossus, palato.
Can you show me
here.
again the
Yeah, here.
palatine tonsil?
Just here, you will see.
Okay.
So
This is uvula,
laterally to the
lateral to the uvula, lateral to uvula, because this is two arches. This is palatoglossus arch, and here palatopharyngeus arch. This is palatoglossus arch, and behind palatopharyngeal arch. So here, okay, here. Yeah, just lateral to the uvula, lateral. So this is uvula, lateral to the uvula. This is palatine tonsil. And which muscle is this?
Corticothyroid muscles.
Cricothyroid muscle. Now, and this is thyroid gland. This is isthmus. This is lobe. Okay.
So under it is the second and third tracheal
Second and
ring.
third tracheal over the second and third tracheal ring.
This is the parathyroid.
Yeah, this is parathyroid usually posteriorly. Okay. When we remove the thyroid, we will find out, because you see just posterior to this area, posterior to this area. So it's posterior to the thyroid gland. Okay, not anterior. Okay. Just now artery vein. Just you identify here. This is common carotid artery. This is internal jugular vein. This is brachiocephalic vein. Okay. And then superior vena
Where's
cava.
external jugular
External
vein?
superficial. Its external one is superficial. Internal one is deep, but external one just below the skin, in the superficial fascia. Okay, but this is deep.
Internal jugular
This is
vein.
internal. External one is the superficial one. This is brachiocephalic. This is internal jugular vein.
Brachiocephalic will give us the two jugular, yes? Internal and external?
No, just vein from the periphery to the center. So this is internal jugular vein. It unite with the subclavian vein. Just I try to. Yeah, you see here.
Yes.
This is internal jugular vein.
Okay.
It unite with the subclavian vein to form the brachiocephalic vein. Okay. So internal jugular and subclavian unite to form brachiocephalic. Then right and left brachiocephalic unite to form superior vena cava. Okay. Internal jugular and subclavian unite to form brachiocephalic. Right and left brachiocephalic unite to form superior vena cava. Okay.
So this is the
Internal jugular.
and this is the
Subclavian. This is the brachiocephalic. This is right brachiocephalic. Left brachiocephalic is longer than the right one.
What is the external now?
External is just below the skin.
We'll go to the what, or it's coming from what?
External jugular just it's a subcutaneous vein, superficial one. So when you remove the skin, you will find out external jugular, and external jugular open into the subclavian vein. Okay, subclavian vein. Here just subclavian like this. Okay, here the curve. You see here, this is subclavian. This is subclavian. So you see this is opening. This is the opening of the external jugular vein. This is the opening of the external jugular vein. So external jugular vein open directly into the subclavian vein. And then artery, you see this is external. This is internal carotid. So where is the external carotid? Is there any good model here? Because this is the same things, I think. Okay? So this is external carotid because this branch is the superior thyroid. This is superior thyroid. Okay, and internal jugular just it goes inside the brain. Okay, so this is the external carotid. Sorry, external carotid, and this branch superior thyroid coming from the external carotid artery.
Okay.
And the other is not clear here. These are the nerve, the vagus, and the other branches. Okay, and the muscle suprahyoid, infrahyoid, you finish it before. Just above the hyoid bone, these are the thyroid gland here. But over the thyroid gland, there are two muscles: sternothyroid and sternohyoid. Okay. Sternothyroid and sternohyoid over the thyroid gland. So thyroid gland is not like just beneath the skin. The skin, then there is muscles, and below the muscles, the thyroid gland is here.
What is over it?
Sternothyroid and sternohyoid muscle. I think this is enough.
Finish.
Yeah, finish.
Thank you.